Why your revenue is lower this year and what to do about it. If your clinic's revenue is down this year, you're not alone. In fact, many healthcare providers are seeing their lowest numbers since the first wave of COVID. But here's what's interesting. It's not just because of the economy, and it's definitely not your fault. This winter has been particularly brutal for healthcare providers. I've been working with physical therapy clinics across the country, and I'm seeing attendance rates plummet from their usual 85 to 90% down to 70% or worse in some areas. Physicians are reporting this has been the worst sickness season since the initial COVID outbreak. But here's the thing, while some of these factors are beyond our control, there are specific actions you can take right now to turn your revenue around. I've spent years helping healthcare providers optimize their revenue cycles, and I can tell you that understanding these factors is crucial. What I'm about to share has helped clinics not just survive tough periods, but actually increase their revenue despite these challenges. Let's break down the main reasons your revenue is lower, and more importantly, what you can do about each one. Number one, the perfect storm of winter challenges. Let me paint you a picture of what's been happening. December through February saw almost unprecedented levels of illness, from flu to RSV to COVID to norovirus. Hospital beds were full, but it really didn't get much news time. Now, this isn't just anecdotal. We've seen the impact in real numbers. Clinics that normally maintain high attendance rates saw dramatic drops. Hopefully you are past that now and are back to your usual attendance rate. But here's what you need to do about it. Start tracking your attendance rate every month. Most EMRs make this pretty easy. It is an important driver, so definitely worth popping on your monthly dashboard. Consider incentivizing attendance rate or total visit number with your front desk team. Determine all the things that can be done to optimize your attendance rate and implement processes for those things to be done each day and week. If you're seeing scary low profit, you may need to staff leaner during these times of poor attendance. And so consider some more flex staff scheduling options. Number two, the insurance company's squeeze. Here's something most people aren't talking about. Insurance companies have been making up increasingly strange reasons to deny claims. Some payers have either intentionally, accidentally, or through blatant incompetence delayed payments significantly across the board. The work required by billing departments has had to increase dramatically. What's worse, more patients have moved to lower paying payers. Take United Healthcare, for example. Because they're an inexpensive option for subscribers, more people are shifting to these kinds of plans. This means your patient mix may have shifted toward these lower paying payers. The third part of this issue is that more payers, and not just federal payers, are implementing a CQ discount for when PTAs treat the patient. And that can be a reduction of up to 16% for some payers. That's huge. Now here's your action plan. Train all your staff in optimal treatment and billing practices. Ensure PTs and PTAs are billing the correct 8-minute rule, AMA or Medicare, depending on the payer. Identify which payers have a greater differential due to the COVID modifier. Consider strategic staffing based on payer mix. So perhaps there are payers that discount on the PTA more than others. You probably don't want your PTA seeing those patients. Take a look at your income per visit and per hour and make sure that you can still make a profit on each payer. For those that you don't, if they won't come to the table to negotiate payment, you have to fire them. Before we continue, if you want my complete revenue optimization checklist that we use with our clients to maximize reimbursement rates, click the link in the description below to download it for free. Number three, the Medicare reduction impact. When Congress failed to act, the Medicare reduction of 2 to 3% kicked in. Also, the MIPS reduction is affecting some clinics now. These small percentage reductions don't sound like much to Congress maybe, but if you're already only just making a profit, it is potentially a death blow. Here's what you need to do. For Medicare, try your best to not have PTAs treat the patient if possible. Look at your timed units per visit to ensure you're billing optimally. Treat at a high level and then bill according to what you treat. Remember, high quality treatment, especially from Medicare's perspective, includes therapeutic activities, neuromuscular re-education, and self-care/home training. Those are the best paying codes with Medicare, so treat in a progressive, high-quality manner using these interventions, and then make sure you code what you treat. Number 4, the staffing solution. Let's talk about something that's actually within your control. When PTs become busier and have to see more visits in a day or hour, their billing performance often drops. When PTs are billing less or billing lower paying codes, reimbursement naturally declines. Well, here's your action plan. Analyze your cost per visit versus revenue per visit. Look at revenue and cost per hour instead of just per visit. Consider firing some payers that pay beneath your cost per hour. Make strategic decisions about PT versus PTA staffing based on payer requirements. Finally, let's talk about the opportunity in this challenge. There are more potential patients than ever who have access to physical therapy, but we need to be marketing effectively to attract these patients. Your marketing strategy should include internal marketing to current patients and staff, consistent marketing to past patients, an appealing and consistent online marketing presence, face-to-face marketing to the general public, creative and consistent outreach to the healthcare population. Let me wrap this up with something crucial. While revenue might be down right now, this is actually an opportunity to optimize your operations and come out stronger. The clinics that take action on these points now will be the ones that not only survive, but thrive in the coming months and years. Remember, it's not just about working harder, it's about working smarter. Take these action steps, implement them in your clinic, and watch your revenues start to turn around. Want to dive deeper into any of these strategies? Check out my next video, where I break down exactly how to optimize your billing processes for maximum reimbursement. Click the video on screen now to learn more.